Welcome, everyone. Steve Adubato. Listen, we're taping at the end of June, but this will be relevant for a long time, and she is always relevant. She's Dr. Denise Rodgers, Vice Chancellor for Interprofessional Programs, Rutgers Biomedical and Health Sciences. Good to see you, Dr. Rodgers.
Good to see you as well. Thank you.
I'm going to read from an article from our good friend and colleague, Lilo Staton, who works with the great team at NJ Spotlight News. Okay? Here's what she says, quoting you: "These vaccines are phenomenally good at keeping you from dying from COVID, and mostly they're pretty good at keeping you from ending up in the hospital, but these vaccines are terrible at limiting the spread of the disease. Just terrible." Question: how, in your mind at this point, almost 2.5 years in, should we be changing these vaccines to achieve what that is not being achieved heretofore in terms of protecting us from getting it?
Yeah, I think, Steve, whenever I talk about the vaccine, I have to reiterate the first point I made, which is they're phenomenally good at keeping you from dying and keeping you out of the hospital, because I don't want anyone to think that my comments suggest that you shouldn't take the vaccine.
And I have every time, every opportunity, every notice CDC sends, I'm first in line if I can be. So just get out there with that. Thank you.
Fantastic. So, but the vaccines are not as good as we would hope they would be. They don't prevent you from getting the disease for many people. For many people, they don't prevent you from spreading the disease. The good news is it does appear that people who are vaccinated who get COVID are contagious for a shorter period of time. So that may reduce some spread. But there are people who are working, researchers who are working on other types of vaccines that may actually do a better job of blocking the virus from getting into the body in the first place and being able to infect you in the first place. And I would just like to put it out there that we need to encourage that.
So here's the thing. I have too many friends who have said to me, "Steve, I got COVID. I got it twice. I don't need the vaccine." I'm not in a position to, nor would they believe me, whatever I told them anyway, as an advocate of the vaccines. They're convinced they're good.
Right.
For how long and in what ways, Dr. Rodgers?
Probably for some short period of time, they probably are good. We know that the immunity conferred by having COVID is actually not as good as the immunity conferred by getting vaccinated. And so again, we need to encourage people to get vaccinated. What we also, I think, don't talk enough about is this reality that you described. We all know multiple people who have had COVID, and by and large, most of them have done phenomenally well. But we need to be reminded that a subset of people actually don't do well with COVID and end up with what we call long COVID. And certainly with the Delta variant, it was estimated that up to 10, maybe more % of people who got COVID ended up with long COVID. It appears that there may be somewhat less long COVID as a result of Omicron, but it still happens with Omicron. And so it isn't that this is sort of a benign disease that we can just say, oh, I get it, I get over it, I'm fine. It's not. It still has significantly higher death rates. And so we don't want to become too cavalier as we think about COVID.
Yeah, and especially if you're unlucky, and some of us who have had very close family members who were the unlucky ones who got COVID, and it was not a cold. That's all I'm going to say. It was way beyond that. Let me try this. The public health system, the Centers for Disease Control, the CDC, being criticized by many, including its leader, right, who has at times appeared in the eyes of many to send conflicting, confusing messages about what we should be doing, when we should be doing it, why we should be doing it. Is it okay for the CDC to just say, you know what, we just don't know?
It should be, because what we know is the human body is an incredibly complex organism. And you layer on top of that a novel virus, and viruses in and of themselves are also very complex in the way in which they act. And people want us in science to know more than we do.
It's science.
It's science, exactly. But what's interesting to me is that the things that we do know well, people reject. So we know well that these vaccines are safe and they keep you from dying and getting out of the hospital. We can't predict what variants will do. We do know that coronaviruses are the type of viruses that will develop variants, and therefore the character of that disease will change over time, as we've seen it happen. I think CDC is trying to play catch up. I do think there are times when CDC attempts to be more reassuring, and we underestimate the intelligence of the American public to be able to understand that in science, there are still some things that we don't know, and therefore we urge you to be more cautious. And what do I mean by being more cautious? I mean, there are times, for example, now, where I encourage people, particularly people who are at any kind of elevated risk, to continue to wear masks indoors.
Inside, outside. Sorry for interrupting, Dr. Wright. Inside, outside, when? Where? How?
Inside. It appears that contagion outdoors is very, very rare. And so certainly this time of year, have your gatherings as much as you can.
Going into the summer. We're in the summer right now. Go ahead.
Yes. And so, but you know, masks, social distancing, hand washing, all those things we talked about early in the pandemic are still very effective in reducing the spread of this disease.
Let me follow up on this. You've seen how politics has invaded public health. There are lots of people who believe there are political sides to COVID, political sides to where you where do you stand on COVID? Like, where do you stand on increasing taxes? How the heck, Dr. Rodgers, did COVID and the treatment of COVID and protecting ourselves and the people around us from COVID, how the heck did it become so politicized?
Yeah, it's actually one of the great tragedies of public health history, without question. And it came, I think, from very mixed messages at the very beginning of the pandemic. Remember, we were getting messages out of Washington that said, oh, this is no worse than the flu. We were getting messages that says, oh, it'll be gone by Easter. And those things didn't happen.
Directly from, I don't care what your politics are, folks. It's your business. From the President of the United States, check it. This will be gone in a few weeks by Easter. Then there's some light, you shoot under your arm. Right, Dr. Birx? That's what happens, and it goes away. When that comes in a public briefing, does that confuse the heck out of people? And they say, I'm with Trump, so that means this can't be real.
Yes.
This is a disease.
Yes. This disease has nothing to do with politics, and what we're seeing.
Does it care if you're Republican or Democrat?
Well, it's interesting, Steve, because what we see now is that disproportionately more Republicans are dying from COVID because they are more resistant to getting the vaccine and also much more resistant to wearing masks, because that's the other part of the tragedy. It's not just it will disappear, but it's also not reinforcing to people, do those things that work to protect yourself, like wear a mask indoors.
Wow. Listen, vote for who you want to, have your own politics, but public health is public health. Yes, there are things we do not know, but when you have people like Dr. Denise Rodgers sharing important information and dedicated her life to public health, it's worth just listening. That's enough of my endorsement for you, my friend Denise. Dr. Rodgers, thanks so much for joining us. We appreciate it.
My pleasure. Thanks for having me, Steve.
I'm Steve Adubato. That's Dr. Rodgers. We'll be right back.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by Kane University, Prudential Financial, RWJ Barnabas Health, Horizon Blue Cross Blue Shield of New Jersey, PSC&G, the Fidelco Group, PNC, Grow Up Great, the Turrell Fund, supporting Reimagine Childcare, and by the Adler Aphasia Center. Promotional support provided by NJ Biz and by the New Jersey Business and Industry Association.
Hi, I'm Abby. You might see me as an ordinary person, but I've been living with a brain injury since 2018. Opportunity Project gave me hope, and I've gained confidence through job skill training and helping my family. Despite my challenges with memory, I see a possibility to keep improving.
If you have a brain injury, you don't have to face your road to recovery alone. Learn more about Opportunity Project and its partnership with Children's Specialized Hospital.